Mr. Speaker, British Columbia has used a treatment as prevention approach to HIV/AIDS, with the result that in the last 4 years, the number of new cases in BC has dropped from 114 to 40. While triple drug therapy is fully supported in BC, here in Manitoba, there has been a failure to act, and the number of people with HIV/AIDS is increasing. Yeah. Dr. Montaner, who's led the effort in BC, says Manitoba will never be able to successfully control its growing HIV problem until the provincial government seriously commits to the needs of patients. I ask the Minister of Health, when will she seriously commit to the needs of HIV/AIDS patients?
Well, thank you very much, Mr. Speaker, and I thank the member for bringing this to the House. I think that in times past we did used to speak a lot about the seriousness of HIV and AIDS, and it seems that that conversation has been lacking lately just in the general public, Mr. Speaker. Mr. Speaker, one of the things that we're making sure that we're doing for patients with HIV or AIDS, or any patient across Manitoba, Mr. Speaker, is to make sure that we're funding health care, that we're providing doctors and nurses, and that we're bringing health care right across the province, Mr. Speaker. It's important to recognize that we have patients, of course, not just in Winnipeg, not just in urban centres, but across rural and northern Manitoba as well, Mr. Speaker. And it's important to make sure that we have a strong healthcare system in every part of Manitoba. That means training more doctors, that means hiring more doctors, and that means having more nurses, Mr. Speaker, so that we can make sure that people get the attention they need, where they need it, when they need it.
Mr. Speaker, the failure of the Health Minister to address the needs of patients in Manitoba is astounding.
No kidding.
Women with breast cancer can't get critical oncotype testing. A diabetes epidemic's raging out of control.
Yep.
The number of children coming to the Children's Hospital emergency room for mental health issues has gone up 6-fold. And now we see there's only partial support for treatment of patients with HIV/AIDS, resulting in an increase in the number of Manitobans with this infection. Will the minister today begin providing full coverage for the treatment is prevention approach to HIV/AIDS, which is now the global standard?
Thank you very much, Mr. Speaker. And of course, we are always looking to provide the best care for people in Manitoba, no matter what health care challenge they're facing. Mr. Speaker, I think it's important to put some facts on the record because the member is unnecessarily scaring people about the things that we do in order to help people with breast cancer. For instance, Mr. Speaker, the Wait Time Alliance has just given Manitoba an A+ for radiation therapy, Mr. Speaker. We know that we continue to expand our treatment and our screening for people with breast cancer. Certainly, we know that our survival rate has gone up from what was only 79% in 2002 to 85% now, Mr. Speaker. We know there's more work to do, and that's why we're making sure that more Manitobans are getting screened for breast cancer, and it's why we've made a commitment for all cancer patients towards the cancer patient journey, so that from diagnosis or suspicion to cancer until treatment begins is 2 months or less, Mr. Speaker, and we'll keep working to improve health care for everyone, Mr. Speaker.
Mr. Speaker, the breadth and depth of the minister's failures are boundless. Failing to provide effective treatment as prevention is resulting in increased numbers of new HIV/AIDS cases in the province. There are 1,100 patients with HIV/AIDS in Manitoba, 400 of whom cannot afford current effective drug treatment, aren't getting treatment. The black hole of NDP indifference grows larger as the minister fails to see that increased HIV/AIDS cases are an increased strain on the inadequately funded HIV program in our province.
And the answer is,
will the minister commit today to guarantee access to treatment as prevention with adequate funding for the HIV program as well, so that the HIV/AIDS epidemic can be reversed here in Manitoba?
Well, thank you very much, Mr. Speaker. Mr. Speaker, the most important thing we can do is prevent people from getting HIV/AIDS in the first place, Mr. Speaker. We know that early testing and diagnosis can improve the outcome for people, Mr. Speaker, and that's why we've got the Healthy Sexuality Action Plan that has been making investments to encourage safer sexual practices, Mr. Speaker, better sexual health, and of course STI prevention, Mr. Speaker. As a result, we are identifying more people with HIV sooner, Mr. Speaker, and therefore able to treat those people, Mr. Speaker, and we're going to keep working to do that.